The third edition Ritshidze report reveals improved HIV services in KwaZulu-Natal, but key populations continue to face hostile treatment. The report also compares data over the last 3 years of community-led monitoring in KwaZulu-Natal. The data, together with stories from people living with HIV, key populations, and other public healthcare users, will be presented at 3 district community meetings this week. For more on this, we're joined now by Ndivhuwo Rambau, Ritshidze project coordinator. Ndivhuwo, good to have you, and thank you very much for coming on. Ritshidze report, what is it used for?
So thank you so much, Thabo. We are a community-led monitoring initiative in South Africa, where we monitor over 400 facilities across the country. In KwaZulu-Natal specifically, we monitor 126 sites, and we spoke to over 1,000 public healthcare users, including facility managers as well as other key staff and facilities, to put together the report. And in doing community-led monitoring, we're trying to understand the key challenges that people living with HIV and key populations face when going to the facilities to collect or, seek healthcare, because we see that our 95 targets are really off, and this can be attributed to the broken healthcare system in the country.
Yeah. It's the third iteration of this particular report. When you compare the data from the last 3 years in the various provinces, are we moving in a particular positive direction?
Specifically for KZN has done well in this quarter that we use the data for the report. Especially if you look at when we published the first state of health report for KZN, where only 29% of people living with HIV received a 3-month refill. Now we see many more people living with HIV having received a 3 to 6 month supply. We're sitting on 61% of people living with HIV. This is an indication that, we're starting to move people to a longer refill, meaning that we're decongesting facilities instead of having people living with HIV having to come every single month just to collect their treatment, which leads to long waiting times, having very full facilities, because then lines are exacerbated by someone who's just coming to pick up treatment.
There is some positivity around staff treatment, or at least the friendliness of staff. What could have changed?
So as Ritshidze, we monitor and we also do advocacy on the spot. So in most instances, where we go to facilities and there is a touch of staff attitude, once we have monitored, we come up with recommendations that are shared at a facility level first through our community monitors, and then we also have recommendations for the district, and then we also have recommendations for the province, which was what was presented at the 3 district community meetings. So engagements with facility managers and also district managers to ensure that people living with HIV and key populations continue to be treated well in the facilities as well.
So you've highlighted some of the issues, but there are 10 key issues which you have outlined in this third edition that you recommend would need to be given some kind of attention. Just take us through some of them.
So I think that the main one that we should really look at is the refusal of services for key populations. It is a dire situation for key populations in the province. And when we say key populations, we're referring to sex workers, people who use drugs, gay, bisexual, and other men who have sex with men, as well as trans people. When we hear the community meetings, the community testimonies in the meetings, it's very heartbreaking for sex workers specifically, where sex workers have gone into the facilities either presenting with an STI and needing help and being told that, you went out and decided to be a sex worker, you deserve this. So it's the attitudes that key populations face when trying to access services. When we look at issues around lubricants, only 26% of the facilities that we monitored had lubricant available. And again, when we look at issues around PrEP is available at all of the facilities that we monitor, and we are asking that key populations be prioritized when it comes to just being given PrEP. You test negative, let's offer key populations PrEP at the time. People who use drugs also shared very sad and heartbreaking stories about not being given either treatment or being turned away or being judged overall for either not coming to the facility, having taken a shower or a bath, and just your appearance means that you're not going to receive any services. There are about 9% who would have liked to be given information on methadone, which is usually not offered in the facility, first of all, and usually offered by, implementing partners within the country. Transgender people also have serious challenges in the facilities. We start with issues of being misgendered as a trans person, and, giggles about how either you're dressed and not being addressed by the right pronoun or your preferred name. And there's also issues around hormone therapy, where almost 44% of facilities did not have any knowledge of hormone therapy. So there is a big push for us to really start doing better when it comes to key populations. And one of our key recommendations had been that we open centers of excellence in each of the districts for each key population group. Recently, a few centers of excellence have been opened. However, they're not specific to key population group, which means that key populations cannot access key specific services that they require.
Is there a correlation between pickup points and the rate at which and the willingness of HIV patients to collect their ARVs?
We have a lot of people living with HIV who indicated that they would like to collect their ARVs closer to home. And that is why we are pushing to have external pickup points. And these external pickup points should be in areas that, people living with HIV can access. People living with HIV should be given an option actually to even be decanted to those areas, for example. And, we just really need to start working with CBOs, with daycare centers, so that we can have more external pickup points, therefore decongesting the facilities and ensuring that healthcare workers also aren't as burdened and overworked, because a lot of people will just be going into that facility to pick up meds. But if you can just go to Clicks or Discam or whatever the case may be, get your 3 to 6 month refill, it means that you only go to the facility once, either for your bloods annually, or if you are feeling unwell generally. So we're really pushing for people who are living with HIV who are stable on treatment to be taken out, to be decanted to these external pickup points.
That's Ndivhuwo Rambau of Ritshidze project there, the project coordinator. Much appreciated, and thank you very much for coming on.